to cover the needle. Okay, and after we do that, we're going to basically just dispose the used needle into sharp container, and that's it. We're done. So we're going to basically uh, lower the bed. We put the side rail up. We ask the patient if they're comfortable, um, and then we'll make sure we put the call bell within the reach. If they need us, they can call us. We'll document the procedure. We'll do hand hygiene on our way out, and we will leave the room. Okay, so that was for IM regular. So now the next injection type would be uh, intramuscular, also known as IM, but using Z-track technique. So basically, all the sites and all the syringe information will be the same for this second type of injection. Just one more thing that I would like to add for the IM medication that we just did. Um, we also, when we are basically in the muscle, we would like to aspirate because we wanted to make sure that we are basically the needle is in the muscle, is we are not in the vessel, and also we don't want it to massage, because if we do that, we're going to basically push the medication from the muscle to the fat tissue or sub-Q tissue, which we don't want to do that. Now, for basically for IM injection using Z-track technique based on cdc.gov website, basically we no longer have to aspirate. And also for the same reason, we don't want to massage the site, because we don't want to basically move the medication from muscle to the sub-Q tissues. Now, for IM medication using Z-track technique, I'm going to be using, I'm going to choose the deltoid site. So I could basically show that on my arm. So uh, here is on the tip of my shoulder. I could feel the acromion process. Now, if I place my two fingers on acromion process, underneath a second finger here where I'm pointing, this is the deltoid, and also so this is the deltoid. So basically the same procedure. We'll be using 90-degree angle. We'll go right straight in, and we'll slowly inject the medication. Um, we'll make sure, because we'll make sure that we'll go slowly, so we don't hurt the patient. And then after that, we will pull the needle out. We will put the gauze on the side and dispose the needle in the sharp containers, and we're done. Basically, same procedure, basically that was mentioned for IM regular. Now, the third type of injection that I like to go over, it would be basically intradermal injection, also known as TB test. So for that, we'll be using the ventral forearm. Also, we could use also upper back, right under the scapula, but this is the most popular site that we'll be using, just ventral forearm. So for this injection, we'll basically we'll be using a 1 milliliter syringe, which we have here. So this is a new type of syringe, which it has the safety mechanism here. So for this, we no longer have to use the one hand scoop technique. Okay, so